The modern clinic is an absolute technological marvel, but it has a big secret. Most of its high-tech equipment doesn't speak the same language, and that creates a huge challenge for doctors. So today, we're going to dive into the IT solutions that are breaking down these communication barriers, using some amazing real-world examples from clinics in Taiwan. Just think about it for a second. In one clinic, you could have an ultrasound from one company, an X-ray from another, and maybe an endoscope from a third. Each one is spitting out crucial patient data, but all in its own unique format. You end up with these digital islands of information, making it really tough for doctors to get the full picture on a patient quickly and efficiently. So here's the big question, right? How do you take all these different data sources and bring them together into one unified system? A system where a doctor can see everything they need from any computer instantly. That's the key to faster, more accurate diagnoses. While the solution has a name, it's called PACS. That stands for Picture Archiving and Communication System. The best way to think about it is like a universal translator and a central library for every single medical image. It's the digital backbone that takes all that data chaos from all those different machines and organizes it into one easy-to-access system. This diagram really shows us how it all works. See, down at the bottom, you've got your devices, the endoscope, the ultrasound machine. They all feed their data right into that central PACS server. That server then becomes the hub, sending the information out to the doctor's workstations. So what's the result? Multiple doctors can look at the same images, work on reports together, and make decisions way faster. It completely streamlines the whole clinic's workflow. Okay, so a PACS is the foundation, but it needs some help connecting to all the different types of data a clinic makes. And that's exactly where eWeb's product suite comes in. It's a set of specialized tools designed to handle pretty much any data stream you can throw at it. This diagram shows you the whole approach. eWeb's system is built to handle 4 key data streams. First, you have your DICOM-ready equipment. Now, DICOM is basically the universal language for medical images. Think of it like a JPEG, but for X-rays. But what about everything else? Well, the system also handles non-DICOM files, live video feeds, and even simple photos. Let's break down the tools that make all this possible. First up is the report engine. So what do you do with lab reports, scanned documents, or referral letters that show up as PDFs or JPEGs? That's what the report engine is for. It takes these non-standard files and just seamlessly weaves them into the patient's digital record, right next to their X-rays and ultrasounds. The bottom line is, everything is in one place. Next up, we've got the filing system. A lot of diagnostic tools, like endoscopes, are putting out live video. The filing system is this really clever mix of hardware and software that can actually grab video clips and high-res still photos right from that live feed, convert them into that standard DICOM format, and send them straight to the PACS. It's the bridge between the analog video world and the digital imaging network. And what if you need to capture a quick picture of something like a skin condition, or even just a paper document? This is where the DICOM camera app is just brilliant. It lets a doctor use a regular old tablet or phone, snap a picture, and it instantly turns that photo into a secure, patient-linked DICOM file. This makes sure that even a simple photo becomes a real, legitimate part of the medical record. Now, you gotta remember, not every clinic is plugged into a big hospital's main information system, or HIS. For those independent practices, there's the work list editor. It gives them a simple, manual way to type in patient information, making sure every single image they capture is tagged to the right person, even if they don't have that automated data feed from a central system. Okay, so we've seen the individual tools, but how do they all come together in the real world? Let's take a look at how these products create complete solutions for a whole range of medical specialties, from pediatrics all the way to veterinary medicine. Our first stop is Binken Women's and Children's Hospital. As a super busy pediatric and ONG center, they're dealing with a huge volume of images from X-rays and multiple ultrasounds. For them, the filing system is essential for capturing those critical endoscopic images, and their network of viewing stations lets doctors work together on diagnoses in an instant. Over at the NUA Fertility Center, they have a really unique challenge. They need to combine ultrasound images with really complex data coming from their lab instruments. Here, the report engine is the star of the show, seamlessly merging those totally different data types into one complete patient file. It gives them that comprehensive overview they need. Now, let's look at a smaller internal medicine clinic, Megatrust. Since they're operating independently without a big hospital's information system, the work list editor is absolutely essential for them. It lets them manually manage patient data accurately and make sure every image gets filed correctly. For a super specialized practice like Excel NT Clinic, the endoscope is pretty much everything. So for them, the filing system is the heart of their workflow. It captures those crucial video frames they need for diagnosis and lets them document procedures with incredible detail. In sports medicine, like at Sayu Kong Sport Clinic, they're looking at a constant stream of X-rays and ultrasounds to track how a patient is recovering. And since they're another standalone clinic, the worklist editor is fundamental to their day-to-day operations, keeping that high volume of imaging data organized. And just to show you how flexible this system really is, get this. It's even used in veterinary medicine. Zhongxing Animal Hospital uses the exact same tools to manage everything from cat MRIs to dog X-rays, even iPad photos. It really proves just how adaptable this tech is for any clinical setting you can imagine. So we've seen how eWeb solutions are perfect for individual clinics, but what happens when those clinics start to grow? Well, this is where the true power of the system really shines. Its scalability. It's built from the ground up to expand from a single office into a huge multi-site medical group. Let's circle back to Binquin for a minute. This isn't just one clinic. It's a whole medical group. This topology diagram shows a much more complex setup. You can see they have a central PACS server connecting to an app server, multiple high-end ultrasound machines, and specialized workstations just for reporting. This is a serious, robust system designed for high volume. And for the ultimate example of scalability, check this out. Nua Healthcare has multiple sites in different cities. As this slide shows, they have separate PACS servers at each location, but they're all interconnected. This setup lets them manage and share data across their entire company as if it were one single unified system. It's an incredibly powerful way to operate. So here's the bottom line. It doesn't matter how simple or how complex a clinic's environment is, a solution exists. From integrating a single endoscope to connecting a whole multi-site hospital group, the versatility of these products means that even the most complicated problems can be solved. And that ultimately leads to better, faster, and more integrated care for patients. So from a single doctor's office to a sprawling network of hospitals, the challenge of disconnected data is being solved every day by these powerful and versatile IT solutions. It's a really fascinating look at the technology that's quietly revolutionizing healthcare. If you'd like to learn more about implementing these systems, please contact HeyTech for more information.